If you're working past 65 and think you can just skip signing up for Medicare because you have insurance at work, stop right there, because missing the right time to enroll could cost you thousands in penalties for life. So there are two things that I see all the time. People either assume that having any employer insurance means they don't need to sign up for Medicare right away. That's just not true. It depends on one big detail, which I'll get to in just a second. And the other thing I see is people just being overall confused whether or not they need to sign up for Medicare if they're working past age 65. And this all depends on one big detail: how big your company is. And I know that sounds weird, but if your employer has 20 or more employees, or you're covered through a spouse's employer with 20 or more employees, you can usually keep that coverage as your main plan and delay Medicare Part B without penalty. Plus, you'll get an 8-month window to sign up after you stop working or you get off of your spouse's plan. But if your employer or your spouse's employer has fewer than 20 employees, Medicare becomes your primary coverage at age 65. That means your work insurance expects Medicare to pay first. Without Medicare, your employer insurance might cover almost nothing, and you could be stuck with big medical bills. So to make the right decision about timing and when to enroll, you need to understand what each part of Medicare actually covers and how it works with your employer plan. Part A covers hospital stays, and it's usually free because you've been paying into Medicare taxes for 10 years. Most people take this at age 65, even if they're still working, since it's free and gives solid backup coverage to your employer coverage. An important thing to note is that if you have a health savings account, or HSA, once you enroll in any part of Medicare, even that free Part A, you can't put more money into your HSA. You can still spend what's in there, but you can't get any new tax benefits out. Part B covers your doctors and outpatient care, and this is where your employer size really matters. Part D is for prescription drugs. You need to check if your employer's drug coverage is deemed credible, meaning it's at least as good as Medicare's options. If not, you could pay more later on. So here's what happens if you miss your Medicare enrollment window. You pay penalties for life. For Part B, that's a 10% premium increase for every year you delay, and you pay that forever. I've had clients get slammed with these penalties because their small employer insurance didn't cover everything, and they delayed signing up for Medicare. It's avoidable, and I want to make sure it doesn't happen to you. So if you're turning 65 soon and still working, here's what I suggest you do. Call your HR or benefits team or your spouses and ask them, how many employees does the company currently have? And then I would also ask them, is the prescription drug coverage credible to Medicare standards? If your employer has fewer than 20 people, you need to sign up for Medicare Parts A and B at 65. And don't miss your initial enrollment period so you can avoid gaps and penalties. If your employer is bigger than 20 employees, you have more options, but don't just assume that your work plan is cheaper or better than Medicare. Sometimes Medicare can help save you some money. Also, watch out if you're on COBRA or retiree plans. Those don't count as current coverage, so you'll need to sign up for Medicare. And remember, once you leave your job or your spouse's coverage, you get 8 months to sign up for Medicare Parts A and B, but only 63 days for Medicare Advantage or drug plans. Medicare rules are confusing, and one mistake can cost you for life. Your situation is unique, so don't guess or get paralyzed with fear or rely on a simple Google search. I'm Callie Navarrete, a licensed insurance broker and owner of NaviQuote. I help people every day figure out their Medicare and employer insurance options so you get the best coverage for you without paying more than you should. If you're turning 65 soon or you're working past age 65 and want to reach out, I'll walk you through all of your options. And if you've got questions, drop them in the comments below. I read every one and will answer them in a future video. And if you found this video helpful, please consider liking and subscribing to the channel. And before you go, click right here to watch my next video on Medicare Supplement versus Medicare Advantage so you can figure out which one's right for you in 2026. Thanks so much for watching, and I'll see y'all in the next video.